You there? Hey.
Hey,
Okay, let's try this again and see if it'll not do the playback thing.
yeah, I was
So,
confused by that.
yeah, I was too. So I just closed the window and started again. So yeah, I wanted to chat with you about the upcoming assignment on failed interventions and why that's so difficult, and um, how to how to search for interventions that don't succeed.
I think that the first thing that makes it really difficult is that the literature isn't really tagged as failed. um, they're not placed into buckets of stuff that worked and stuff that didn't. That's something that if we handled the literature that way, it would make a search like this a lot easier.
Hmm.
But as it is, there's not like, really a category that we call these subject headings that
Hmm.
literature like that is filed under. So as a result, you kind of need to fall back on really thinking about all the terms that could possibly identify literature that describes an intervention that didn't uh, didn't work. So we you saw. I'm not sure if you shared some of Meg's approach to doing that, but uh,
I,
so,
ha- I haven't shared anything yet with students, so.
uh, searching for terms like null hypothesis, ineffective, and so the thing that's going to happen with this is there's going to be a lot of noise in the search results, and I think that it's really it's a good lesson to learn that in doing research. You often need to wade through very large result sets in the interest of finding the things that are really relevant to your purpose.
Hmm.
So that's a good lesson to come out of an assignment like this.
Hmm.
Um, Now, I don't think that students just need to limit themselves to doing the keyword searches and developing. Although I think that it could be a great search strategy development exercise, they can also do things like if they look in the Cochrane Library of
Hmm.
Systematic Reviews or the Campbell Collective, which is like a more social science-oriented systematic review authority. They can find um, reviews that are based on evaluating like a certain research question or purpose or objective. And it's not uncommon to find examples where the, the, the team that's doing the systematic review don't find evidence to support the purpose or the research question. Uh, as an example I used in a class just the other day was a systematic review that was evaluating clinical trials on the effectiveness of yoga therapies as a alternative form of cancer treatment.
Hmm.
There, they didn't find evidence to support that yoga, uh, cause lower cancer remission rates or something like that.
Right.
And that's the nice thing about systematic reviews is that because there's such effort to make them a transparent process,
Hmm.
that they have to register the research question first, and
Hmm.
if they don't find a positive answer to the research question, they can't go back and change it. They have to say, we didn't find evidence for our research question.
Hmm.
So looking at some of the studies that were included in a systematic review, um,
Hmm.
for which the reviewers found that there was a low quality or
Right.
little evidence to support the
Yeah.
question, could be a way of identifying
Hmm.
studies of failed or uh,
Hmm.
interventions for which there was weak evidence.
Hmm. Hmm.
Um, and conceptually, that's an interesting thing that comes out of this question too, is
Hmm.
that uh, lack of evidence doesn't necessarily mean failed or that it doesn't really work. It just means
Hmm.
that there wasn't evidence there in that one situation.
Mm-hmm.
Another thing they can do is look at the clinical trials registry,
Mm-hmm.
and the, all of these things, like the Cochrane Library, Campbell Collaborative, clinical trials registries, were developed to try and reduce this thing called publication bias, where
Yeah. Could you talk a little bit about publication bias? Because I think that's part of it's really the point of this exercise, this assignment, is to help people sort of more fundamentally understand publication bias and how it influences the literature on interventions.
Sure. Publication bias, briefly, is the tendency for researchers to find what they expect to find, and to publish positive results.
Mm-hmm.
And there's I've read a little bit of the literature about publication bias, and there's some there's some evidence that it's very often self-selection. People, researchers, maybe don't think that people will be interested in their negative results, or it's less that they submit them to journals and are rejected, but more often that they just choose not to go forward and publish them. So that's also sometimes called the file drawer problem. The problem that there may be all of this evidence, in the file drawers, or now probably the hard drives of researchers, that just doesn't get out there. So when we go and try and do things like systematic reviews, there may be inherent bias in that process because of the reviews that are being selected. The pool from which we have to draw inherently consists of more positive forms of studies than it does negative.
Right.
So the clinical trials registry is something that is a measure that's been adopted to try and reduce this publication bias. So that way, there's a track record of what people are trying to test and what results come out of it, whether they get written up in a classic formal report or not. So if you go into the clinical trials registry, you can get a record of what the purpose of the clinical trial was supposed to be, and what their outcome measures were, and what data they collected as well. And that could be a productive exercise for your students as well, to examine the clinical trials registry and see if they can find things that didn't get published in there.
Great. So maybe you could follow up with an email that has links to some of these resources that you mentioned, the Corcoran, the Clinical Trials Registry, and I think there was one other that maybe mentioned. So, and I can post those along with this video.
Sure. Yeah, I would be happy to do that.
Great.
Can I ask you some questions?
Yeah, sure.
I'm really curious about how this assignment came about. I thought it might be to sort of introduce the publication bias concept thing, but I wondered if there was what else inspired it.
Yeah, I mean, I think the main thing really for me was talking about the publication bias, and also, just sort of, the goal of this class for me is really to get students thinking critically about interventions, and I think that there's this kind of even bigger assumption about interventions, that if you just do something, that you're doing good. Like you're helping in some way, you're improving health in some way if you just do something. And there's even an organization now called Do Something. And so I was really trying to get at, sort of the larger point is, you can actually do harm with interventions, and we don't talk about that. And it's actually never written up. The way that harm gets done with interventions. I mean, it's rarely written up, because often the people who are harmed don't have the power to write those narratives, or they have the power, but they don't have the power to get those narratives published. So it's really also an exercise in understanding the kind of power dynamics about what, sort of in sociology, my field, we would call it the sociology of knowledge, about sort of what gets published and what doesn't, like whose narratives get told and whose don't, you know. So, I mean, that was really the impetus behind it.
The that harms. That's an interesting
Yeah.
thing to think about. Is as much as there is a deterrent to not publish things that you might think are boring or uninteresting. To publish things where it was like, oh, we did this thing and here's all the bad stuff that.
Yeah, very, very hard to get that published or to talk about it. You know, it's just really hard to think about. You know.
But well, certainly with medications, adverse effects.
Right. Right.
Is something that I would consider putting in the search strategy,
Mm-hmm.
or just adverse. And here I'm thinking specifically of the organization of the PubMed literature database.
Yeah.
They have a subheading, adverse effects, that can be applied to like any concept.
Yeah.
Like including health education. It might be like non-medical forms of interventions that you could identify and then associate with the adverse effects subheading.
Yeah.
Trying to maybe get at a pool of literature that deals with the harms of certain types of interventions or approaches.
Yeah. Yeah.
Yeah. So yeah, I'm glad that I asked you that question.
Yeah, so I think that's it. Do you have anything else to share with the students?
No, those were. I wanted those resources. Wanted to ask you a little bit more about the assignment, and yeah, I think we hit all those things. So I'm feeling pretty good.
Okay, cool. So yeah, if you'll just send the links, then I'll post this YouTube on our discussion board, and I'll send that to you as well.
Excellent.
Great. Thanks for your time, John.
Thanks, Jesse.
Okay, bye.